Approximately 10 million people in this country suffer from seasonal affective disorder, a condition that's not simply a case of the winter blues. It's a disorder that has real effects on mental health. Joining me to discuss it is Dr. Danica Moore, the editor-in-chief of Women's Health for Life. Welcome back, Dr. Moore.
Thank you.
Great to see you. So, seasonal affective disorder, it is an actual form of depression, right? Much more than just the winter blues.
Yeah, it's basically a subtype of depression. And lots of people listening to this will feel like, oh, I have that. You know, I always get bummed when it's not nice weather. This is beyond that. This is real categorical symptoms, including feelings of hopelessness, not being able to do your normal activities of daily living, decreased interest in sex, decreased interest in work, oversleeping, sometimes as much as 2 hours extra per day, and then an interesting symptom, having severe carbohydrate cravings. And patients really gain a significant amount of weight. But the hallmark characteristic of this diagnosis is that you have months of depression followed by months of feeling fine, or months of mania,
so
and it goes according to the calendar.
Right, so that's what's linking it to the season.
Exactly.
And I would guess that the most common form is to actually have the depression during the winter that gets lifted in the spring, right?
Right.
So let's talk about that one first. What are the symptoms you should look out for in the fall that might suggest you're falling victim?
This is usually a pretty sudden change when you feel that change in the weather. Ironically, it's not the temperature that's the trigger. It's the shortening of the days. So in our area, in the Northeast, this would begin in late October, early November, and usually persist till around the first week of April. Ironically, this week is a bad week for people with seasonal affective disorder, or SAD, which it's known as, because of daylight savings time. So even though we get longer daylight later in the day, studies have shown that exposure to more light earlier in the day, right upon awakening, is more important. And of course, now we're all waking up in the dark.
Absolutely. Okay, so let's talk then about the other form of seasonal affective disorder, which is it's a little bit less common, and that's when you get depressed in the spring and the summer, correct?
Yeah, that is much less common, and that's just a reverse. But ironically, it's not the same symptoms at a different time of year. It's different symptoms. So whereas the fall-winter seasonal affective disorder is characterized by lethargy, hopelessness, more depressive symptoms, the spring version is characterized by more anxiety. So sleeping less or having insomnia, being very on edge, feelings of overwhelming stress, also leading to not being able to do your normal activities.
Does that make it a little harder to diagnose?
Yes. And this disease, or this condition, it's not a disease, this condition is very often misdiagnosed as hypothyroidism, as various viral illnesses. You know, many times in the fall, of course, we're getting all kinds of colds, coughs, flu at the same time.
Right.
And it's difficult to make the diagnosis. The real key is the calendar.
The calendar. All right. I guess we should also add that there's another SAD out there, too, that has nothing to do with this one, right? That's
right. Social anxiety disorder. So same acronym, but different, totally different.
Another segment.
Mental health problems.
Let's talk about ways that we can treat this, because it's my understanding that this is mostly linked to the lack of sunlight, correct?
Right. Or the lack of light.
Or lack of light. So what can one do? Can you put up a special lamp in your house?
Absolutely. And first of all, anytime we're talking about any medical or mental health problem, we're talking about lifestyle changes.
Right.
So you can raise the blinds, turn on the regular lights in your house. Exercise has been shown to be incredibly helpful, as with any kind of depression. Of course, one of the hallmarks is people don't feel like exercising because they're depressed. But then when we get to medical therapy, phototherapy or light therapy has been shown consistently to be as effective or better than antidepressants. And what people use is an actual light box, and you can buy these on the internet. They range in price from $200 to $400. You don't need a prescription, but many times your insurance company will reimburse you if you have a prescription for this. And what you have to do is sit about 12 inches from this light box and look at it, but not directly at it with your eyes. So you might want to be reading a magazine, sitting in front of this light box for anywhere from 15 minutes a day to an hour a day, depending on how severe your symptoms are.
Oh, that's fantastic.
But people report positive results within 3 to 5 days.
Now, Are the levels of serotonin in our bodies linked to light exposure?
Yes,
Okay.
And that's one of the theories for the etiology of this condition. We don't really know the cause per se, and there are many factors. It is more common in women. It is more common in people who have a family history of depression or bipolar disorder, but there are many other factors.
Can it happen to any age? It
can happen at any age, but most frequently we see it in people in their 20s to 50s. Serotonin is believed to be one of the possible mechanisms. Low levels of melatonin. So many times people take melatonin at night about an hour before they go to bed. Different doses work for different people, but usually we're talking about 1 milligram to 3 milligrams per night. This is over the counter. But many times people have to have antidepressant therapy and psychotherapy.
Now, even though it is more common in women, I've heard that men can experience more severe symptoms. Is that correct?
That's true. And men, of course, are less likely to go to their doctors and talk about it. So that may be also a reporting difference. Women may go sooner. Of course, if you're having any kind of depression, it's important to talk to your doctor, especially if you're having feelings of such hopelessness that you're having thoughts of suicide or missing work or it's interfering with your relationships.
Absolutely. And so the therapy is the same for men and for women. Is it the same for the winter seasonal affective disorder as for the summer version?
Yes, it is.
It is. Interesting.
It is. And the summer version is really much less common than the winter version.
And finally, how can you determine that fine line between the winter blues and slipping into seasonal affective disorder?
Like many things, I don't want people to feel like they have to make their own diagnosis. If you're thinking, I may have this, talk to your doctor about it. And there are questionnaires. There is a questionnaire online that can help you at cet.org.
cet.org.
And it's free. And that might be helpful to print out and bring to your doctor.
Thank you, Dr. Dunnick, for more great information. And for more health news and information that's good to know, please visit the health page at abcnews.com.